Yeah, so as I said, my name's Brian Campbell. I'm a clinical scientist and the training lead in echocardiography at Guy's and St. Thomas's. Guy's have a long history of looking after STPs. They were involved right from the start, and I got involved in 2016, and you kind of learn from experience as well as attending the Train the Trainer events. So I'm going to discuss the case-based discussions and how my approach to that really about creating efficiencies in OneFile marking, and it has evolved and changed over the years. So I think the first thing you have to do is decide what type of case-based discussion is the most appropriate. You then need to define very clear goals for the trainees and say, this is what I expect of you, so they know in advance. And that would include how you've determined the format and what way you expect them to present that material to you. And then that will obviously influence the marking process that you have. You then go through the whole OneFile component, including the feedback process. And then just at the end of this whole event, I'm happy to take any questions that you have. But also, when you're having the event or the case-based discussion with the trainee, having questions and making it interactive is really important. I'm slightly different from many of my physics colleagues. I come under the umbrella of physiological science, cardiac science in particular, and then a subset of that at echocardiography. I do have other colleagues that train people in rhythm management in the labs, etc., but this is my specialty, echo. So whenever I'm thinking about what way I want them to present, this is very much a patient-facing role, and the patient has to be at the center of your care. And when I think about the format that I want to, or thought about it over the years, how I want them to present it, I was heavily influenced by multidisciplinary team meetings and observing how the medics present their patients and explain what the process is, what they think their query is, and potentially asking for advice on what the next step should be. And it also helps to teach them these presentation skills for learning and advancement in the future. So I'm just going to use a quick example of the kind of thing that I would use. This is just a brief synopsis. So the patient might initially present as generally unwell, so which is incredibly vague, and but that's your starting point. That's where you have to go from. So I'll expect them to have gone back into the patient's notes and find out a bit of background before they present the imaging component. So, for example, this particular patient was admitted to a GH, 4-week history, feeling generally unwell, but their oxygen saturation was normal at 96%. They were able to speak in full, clear sentences. The respiratory rate was within normal range, and there was no coughing or wheezing with a bilateral chest expansion. So they'd already have ruled or minimized the potential for it being respiratory in nature. They then go into how the patient was in continued monitoring with a normal heart rate, not many ectopics noted. Patient was normotensive, so it wasn't a blood pressure issue, and then apyrexia of essentially a normal temperature. And these are the kind of standard things you would expect to see within any history taking and observational skills. So from that, they'll have been decided what the next course of action would be, and it was a chest x-ray, an urgent review by the cardiothoracic team, who then subsequently ordered the inpatient echo. And this is really where the student would be first encountering the patient. Just to briefly orientate you, this is a cardiac ultrasound. The top of the image is where the probe would be based. And what you can see here, this is the left ventricle contracting well. You can see the valves. This is the mitral valve further, or the lowest in the image, and the aortic valve that you can see in the other image. From this, I would expect them to describe this to me if they thought the function was good. Do they think the valves are normal? Is there any particular abnormality they think they can see? And then zoom in on whatever they think the pathology might be. In this particular image, the top part of the valve is well seated and moving normally, whereas the bottom part's swinging about. It's what we would call dihist, and there's clearly an issue with this particular valve, and it's probably an aortic valve replacement of some description, but they'll have to go into more detail in the history to determine that. Whereas a patient presents to you in a DGH, you may not have all that fundamental information, so you really have to go about investigating all of this. So So then you'd expect some color flow Doppler, which some of my ultrasound colleagues and elsewhere would be familiar with. And what you're expecting to see is a central jet of color, but you can see, don't know if you can see below that. You probably can't see can you see my hand? No? Let me, probe moving, no? Probably not. There's a wee area just below that that's also demonstrating that there's color flow where there shouldn't be. So then we want the person to explain what's going on, what's happening with the valve, and they'll go into it in more detail. And ideally, they will have taken these particular images themselves, so they'll be describing what they've done, and you can interrogate them and speak to them about how they acquired the image, if they have any practical bedside issues. And then this is the descending aorta, and what you should see is a solid blue flash intermittently, but you can see blue, red, and this clearly describes for us, from our perspective, that there's significant diastolic flow reversal that shouldn't happen. So the overall conclusion you'd expect to see is this patient really needs an urgent intervention, specifically cardiac surgery. So what do you think about when you're setting up the process for the trainee? You have a tick list to follow. There's good information on the website about case-based discussions, and that's listed at the bottom. But if you just type in National School Work case-based discussions, that'll take you pretty much right where you need to be. But it'll describe how the assessor, you're responsible for conducting the whole case-based discussion, completing the marking form, and particularly important, providing constructive feedback and determining an outcome. Take them to a quiet space. I like them to do a bit like I'm doing today, present on a PowerPoint presentation. The discussion should last at least 30 minutes, but no more than an hour. And then as part of the process, you're trying to demonstrate that the trainee is critically reflecting on the case, thinking about their thought process on it. Did they learn anything from it? And is there anything that they would have done differently should they be doing it again? So this is the form that that's the new form that the school provides. Initially, the trainee will have drafted this as part of the documentation and sent it to me in the form of an email. So all the details in terms of who's doing it, who's assessing it, what module or title code is applied, the date of assessment, and the case title is all there for you. In terms of marking, they also provide you with basic information about how you should assess. There's a pass-fail criteria, and essentially you're trying to decide if they're first of all safe. Is their decision making and problem solving appropriate? Is there anything that they missed that they could have done better? And that can be something that's small, so it may not affect or impact on the fact whether they passed, but it's useful for them to have this kind of information to take away and think about. They're then broken into subsets, but this is just the first three, where you practice safely and effectively, pass, fail. So it's a straightforward process that way. There's no scoring system as such, but it's really important that they give good feedback. And sometimes people will do other DOPs, etc. in the department that's not been performed by me, and they maybe leave this blank. I'll send it back to them, I'll reject it and ask them to feed back the feedback component, because this is really the most important in terms of helping the student to assess themselves and see where they currently sit. Then you fill in that document and email it to them. They then take it and upload that onto OneFile. That then appears as a task for you to complete. I'll also ask them to upload the presentation that they presented. And then when you go into that, there's also an opportunity to create a task based on the feedback that you give them. Since you've done that and they've submitted it, you may feel there's something else you've thought about and could have given them additional advice. So it's just another opportunity to give them a bit more feedback.